the famous Shawn Wells. He is a juggernaut in the industry of all things supplementation, vitamins, and he's so knowledgeable that many physicians, including myself, reach out to you to formulate supplements. Many practitioners do, to formulate supplements from scratch. And just the level of knowledge you have to have of biochemistry, organic chemistry, just medications in general, pharmaceuticals, it's just massive. How, Shawn, how did you get all this information in your head?
I don't know. Honestly, I grew up and my mom was into Shaklee in the 70s. I don't know if you know that brand, but it was a whole food brand from Europe. And I took this vitamin called the Vita-Lee from Shaklee that was a whole food multi way back in the 70s. And that was around the same time as Dr. Linus Pauling was starting to talk about orthomolecular dosing around vitamin C. And that was really shifting our thought process around, oh, vitamin C is just for scurvy and deficiencies and 60 milligrams. And now we're starting to talk about grams and that it may affect our health in different ways. And so we started viewing these nutrients very differently. And then we started looking at traditional Chinese medicine and herbs and, going really back to the roots of medicine and not just where pharmaceuticals lie, which, again, I'm not anti-pharmaceutical by any means, but, certainly there's thousands of years of wisdom that we've kind of shunned and now it's time to revisit, and I'm excited about that. So for me, like that's where like a lot of my passion started. And then I ended up getting my master's in nutritional biochemistry at Chapel Hill and studying exercise sports science and working as a chief clinical dietitian for a decade in acute care and long-term care. And then all the while working with supplement companies, helping do write-ups, working at these shows and kind of working my way up, director of R&D, chief science officer, and then really building out several of my own companies around study design, intellectual property filing, unique ingredients, sourcing, formulating, speaking on stage, and all the things that have happened. But I love supplements. I live this, like people talk to me about it constantly. I never get tired of it. This is my passion. This is my purpose.
That definitely comes through, and we're so lucky to be associated with you because, I feel like the whole supplement industry, because it's unregulated technically, um, there's so many players in it, and there's so much confusion, and it's incorporates so many different actual compounds, right? Like, so let's talk about is supplements are micronutrients, supplements are herbs, supplements are even mushrooms. There's such a huge variety of compounds that get thrown into this bucket of supplements. And how do you kind of talk to people about the differences, similarities, and just the breadth of the entire field?
It's really, it can be overwhelming if you're
Oh,
coming in from the outside. And like, what is a supplement? Like you're saying, like, we have the Shea Act, right, from the 90s, where really something needs to occur in nature or be a metabolite of something that occurs in nature at the very least. And it obviously needs to be safe. Uh, so there's a lot of things that are being used in and around supplements that aren't necessarily supplements. An ingredient that I love, methylene blue for anti-aging, is not a supplement. And some of these peptides can be like a little gray, and some of these different things that are out there that I think are great for anti-aging that I think are safe aren't necessarily supplements. So it is a little confusing right now. And of course, we're abutting against big pharma, and sometimes they're coming in and trying to take some of the ingredients that are supplements and saying, "Oh, those are ours now." Like we've seen with N-acetylcysteine, with NMN. So there's some things that are happening that are frustrating. I've even heard, D3 and methylcobalamin, could be up for concern with big pharma coming in and grabbing those. So
wow.
there's a lot of confusion, and I'm here certainly to walk through that.
Yeah, I think you bring up a good point. There's this constant push and pull with big pharma and the supplement
Mhm.
industry. And we saw it pretty publicly with NMN, and it's concerning because, and we saw it with peptides too. It's concerning because as a practitioner, I regularly prescribe peptides and of course vitamin D. I mean, it's part of what I consider foundational for a lot of people. And if when big pharma gets a hold of it, number one, it completely takes it off the market. And
Yeah.
number right. And as a practitioner, we can't really use it until it's gone through its $1 billion study protocol, which my concern is a lot of these very beneficial compounds might not be available anymore for people, right?
It's so frustrating. This brings to mind like when I was working at a skilled nursing facility, working for long-term care and especially with neurodegenerative diseases. There's a huge issue with sarcopenia, cachexia, all these kinds of things, muscle loss, very important. And so I wanted to put all my patients, all my residents on creatine because, one, I had studied it heavily, I had written chapters about it in sports nutrition books. There's over 500 studies on creatine. And I remember my rounding physician was like, well, why would I put someone on that? What research is there? And I'm like, bro, 500 studies. The medications you're putting them on, there could be one or two studies, and that one study they've done for several years and they keep redoing until it pushes it over that 50% threshold of being efficacious. And then it's good to go by the FDA.
No.
But meanwhile, I'm getting questioned about something that could be found in the diet is a healthy nutrient for brain, for muscle, for eyesight, for sexual organs, for all these different benefits, and has 500 studies showing safety and efficacy, and you're questioning it because it's a supplement.
Right, right. Yeah, it's mind-blowing to me too. And I could tell you, I was trained in typical Western medicine where you spend months, years studying pharmaceuticals. You spend zero time studying foundational supplements like vitamin D, creatine, et cetera. So the knowledge in typical Western medicine
Yeah,
protocols is just not there, unfortunately. And could think about the all the people that are suffering in like the ICU or in the hospital, where something like you did right there, recommending creatine could make a massive difference for them.
huge.
Yeah, it's just incredible. And so I think there's a lot of work to be done, and sometimes it gets frustrating when things go the opposite direction. But we need to all be part of that solution to keep these substances in front of people. I'm glad you brought up creatine because I want to talk a little bit about what supplements do you consider somewhat like foundational that most people, if someone came to you and said, hey, I'm only going to take 4 to 5 things, what are the ones that you think should be high on people's list?
That's a great question. Creatine would be towards the top because not only is it protecting muscle, and look, the number one most important predictor of longevity is muscle mass, maintaining that muscle mass and maintaining the strength of that muscle mass. Like a grip test is probably the easiest test we have for how well you're aging. And again, going back to the nursing home thing, I mean, think about, I'm not talking about 90-year-olds. I'm talking about 55, 60, 65-year-olds slip, fall, break a hip because they have low bone mineral density, because they don't have good proprioception, because they don't have good muscle mass, don't know how to use it well, and they're in a nursing home. They get a urinary tract infection. They end up getting a pressure ulcer because they're sitting too much. The pressure ulcer gets infected and they can die. These are
Yeah.
people like, you think this sounds crazy. It's not. Like a fall can turn into that very quickly.
Mhm.
So, this is the kind of thing that creatine is so potent and powerful for us as we age, and we're not getting enough of. Yes, it's great for athletes and explosive strength and sprint speed and those kinds of things. But also, we're seeing it be protective, like I was saying, to brain function. It's protective against traumatic brain injury. We're seeing
Okay.
it improve sleep quality. We're seeing it help with that bone mineral density. We're seeing it improve sexual function, especially with the testes, but as well as the ovaries. There's just so many ways that we're seeing creatine be this powerful buffer to improve whole body function. So I believe it really should be added to a great multivitamin. And of course, I do believe that a multivitamin can make sense, but I want to see organic forms of the minerals. Those have much higher bioavailability. So things like the Krebs cycle intermediates attached to the minerals. So things like malate or citrate, or the amino acid chelates, so things like glycinate or threonate or those kinds of things attached to the minerals would be great. Also, I want to see methylated B vitamins. So, like as we know, 5-methyl tetrahydrofolate would be a way to address the MTHFR gene issue, which so many of us have. And we know methylcobalamin is far superior to cyanocobalamin, all these kinds of things. So looking for the methylated B vitamins, looking for the organic minerals would be great. So those are going to be important with a multivitamin. Creatine, I like the adaptogens. So normally I wouldn't just throw herbs in kind of like my very top list. But the reason I'm saying this, I wrote a book called The Energy Formula, and I do believe that resilience is at the core of us living our best lives. And so this is the idea of allostatic capacity and allostatic load is the size of your stress bucket. How much stress can you take on? And this is the reason that adaptogens are so unique. They're bimodal, meaning that it can improve sleep and improve energy. And that's so unique. Why? Because it's enhancing your resilience. You're becoming more optimized. And this is one of those things that's going to help you deal with the stress of life, not just psychological stress, but physiologic stress. And so I love things. If you look at history and the most important herbs throughout all these different cultures, in Russia, it's rhodiola. In Asia, it's ginseng. In South America, it's maca. The reason these are such storied herbs is because they're all adaptogens.
Mhm.
And so those are some of my absolute favorites. And I like to cycle through them. I like to use rhodiola, and then I like to use ashwagandha, that's India. I like to use maca. I like to use these different things. And we see, again, enhanced sexual function, increased GH, and improved sleep quality, also improved focus and attention, improved energy. Wow, like it's doing everything because we're being optimized and we can handle more stress.
Right.
So I love those a lot. And I do believe now gut health is obviously massive, and not just for digestion, but we know about 80% of our immune system functions in the gut. About 80% of our neurotransmitters are from the gut. So your health and happiness is based truly out of your gut. And if your gut is dysfunctional, if your gut is dysbiotic, then you are not going to be functioning well. So I like not only looking at probiotics, but I think more importantly is looking at pre and postbiotics as well. And then collectively, it's called a symbiotic. And there's even a category called psychobiotic, like where the gut is determining a lot of the neurotransmitter, disposition, psychological disposition of you. So, getting something like a phage, there's an ingredient called Pre4 Pro that I'm a big fan of as a prebiotic. Some of these spore or more stable probiotics that I like as well. Akkermansia is really interesting right now for GLP-1. And then postbiotics, so butyrate in particular, there's some other short chain fatty acids like acetic acid and propionic acid, but probably most important is butyrate. And probably the best form supplementally is its triglyceride form called tributyrin. That's the postbiotic, and that's what these probiotics are actually making. So I like taking the collective as a symbiotic. Lastly, this is an interesting one. This is just one I'm a big fan of, and it's called dihydroberberine. It's the optimized form of berberine. I just think everyone should be on this. Like 87% of the people in the United States are metabolically dysfunctional. That means we're heading towards almost every disease, syndrome X, whatever you want to call it. Almost all disease states are metabolic in nature. And then we're also seeing faster biological aging over chronological aging with people. We're seeing not enough NAD. We're seeing mitochondrial dysfunction. All of this kind of stuff is collectively putting us in a position where we're in insufficient cellular energy states. We're aging faster biologically. We have a greater propensity towards all disease. And this is an AMP-K activator, and it's also a GLP-1 agonist, and it's going to increase mitochondrial biogenesis. So I just think this is a miracle one, especially in our Western society. We should be on dihydroberberine, and this is just an optimized form of berberine that's about 5 times more bioavailable, less GI distress, all that kind of stuff.
Love it. Yeah, what a great list. And those are all definitely top of my list too. But do you include like vitamin D in your multivitamin? Is that kind of where that comes in?
Yeah, I was just going to add vitamin D3, but absolutely, it could be in the multivitamin. But I do believe, to your point, there have been studies done where dry D is just not nearly as effective as the oil-based. And even better is if you have the oil-based with a fatty meal or some kind of fat source on top of it. Even better is if you add in K2 to your D3 and even still get some sunshine on top of that, especially that red light sunshine kind of at the beginning of the day and the end of the day is really good. Then there's less likelihood of burning, et cetera. And so I love that as well. So yes, I'm a big fan of D3. That would be in the list as well.
And last one I want to put in front of you and get your opinion on is an omega-3 supplement. What are your thoughts around omegas?
Yeah, that I love it. It's difficult. One, with the plant source, we're seeing that is about a tenth as effective as the animal sources, right? So the vegan omega-3s just really don't stack up as well. The fish oil source, you just have to be careful. Like I like to get something that's IFOS certified, IFOS certified, where it's molecularly distilled. It's being fished from like these Norwegian waters. You don't have the mercury or radiation concerns. You just have to be very careful with the source. And I do love if an antioxidant is added to it, like, with astaxanthin or, some of these carotenoids would be really protective of that fish oil. So you just have to find a really good one. And I do like, it does seem like DHA leans a little bit more brain health and EPA is a little bit more cardiovascular health. A really interesting one from Menhaden fish is one I've been exploring that's DPA. And that's probably the most exciting, but there's not as much research on for cardiovascular health. I think that one could be very potent, especially when looking at like LP little a and some of these kinds of things.
Right. No, that's so well taken because, I think that one of the points you repeatedly make is really understanding where your supplements are coming from. And, there are so many choices out there because anyone from anywhere can make one and make a supplement and sell it on Amazon to you now. And they can buy reviews. And so just because something has a 5-star review doesn't make it a good supplement. And case in point, with your with what you were saying with the multivitamins, there are hundreds of 5-star reviewed 10,000 reviewed multivitamins out there, and they have cyanocobalamin in them. They have these forms of nutrients in them that are actually harming you and not beneficial. And so how does like the average person know what to do?
Well, I think you need a Dr. Darshan Shah and a Shawn Wells on your side, to be honest. Like, I really have concerns. As much as I was an insider and had concerns before, when I saw like Now Foods, who's been in the industry as really one of the better companies for the last 30 plus years, they've done testing on Amazon over 13 different nutrients over the last year and a half or so. And about on average, I would say, this is me ballparking this, but about on average, 80% of the products are not testing out to the label of what they're ordering off Amazon. And about 40–50% have little to no active at all. I mean, not just below the label claim, but in many cases, nothing. And making it even worse is some of your elite brands, like think of like Thorne or Designs for Health, Pure Encapsulations, these brands that a lot of healthcare practitioners use, are being counterfeited. So this is like, it's a huge problem. So I would say 80+% of what you're buying on Amazon is not legitimate. So there's a lot of concern here. And, on top of that, there could be things that you don't want in there. They're testing the actives, and that's upsetting. But there could be heavy metals, there could be banned substances. If these are coming from kind of subpar contract manufacturers, then that's a concern as well. Especially if you're a tested athlete, et cetera. Like there's a lot of things in there that you could be getting that you're not bargaining for. And we've also seen time and time again, some of these nutrients like melatonin or D3 that are very small active doses were made by companies where they were off by tenfold, 100-fold, and people got very sick. So this is one of those things where, look, I would tell you, do not buy what's cheapest at all. Buy what's best, go with the gold standard, and go from there. But don't add in 10 things from a cheap company. I would rather add in 1 or 2 things from a good company and be sure that you're getting what you want to get and avoiding what you don't want to get.
Absolutely. And that was one of the major struggles I had as a practitioner, giving my patients supplement recommendations, because then they're like, okay, well, what brand should I get? What exact dose, what form, etc. And then they still go to Amazon because it's more expensive when you're buying the good stuff, right? And then they
Yeah.
end up causing more harm than good. And so one of the big reasons we formed Vitaboom was to make sure that people got exactly what I wanted them to get. They don't have to worry about the brand. They don't have to worry about the dose. It's exactly what I would take, what I would give my family, my kids as supplements. And so that curation, like you mentioned, it's so important because there's too many choices out there. The other thing that I've noticed, just to add to what you said, Shawn, is that a lot of times you buy a bottle of the supplements and you don't even really think about how long it's been sitting in the short shelf or how long it's been sitting in the Amazon warehouse. And then you get it, and then you maybe don't take it for a couple months because you're traveling or whatever. And then it loses efficacy over time as well. And so that's something else that people really need to track and consider with their supplements at home is how long have they been around, right?
That's an absolutely extremely important point that I work on all the time with the companies I formulate for, is that we work on not only real-time stability, but it's called accelerated stability, where we're looking at how these formulas interact, that all these different nutrients can interact, all the different excipients can interact, and then add in heat, light, moisture. We don't know how it all interacts. So we need to track these things to have them blended and tracked to where we're looking at how all these things are testing out. And we need to make sure that the label reflects that for the full 2-year shelf life. And this is what Now is essentially saying, maybe some of these companies are under formulating, but maybe it's what you're saying where they don't have the stability and they didn't do the work. Because it's not only supposed to be those levels at the time of manufacture, it's supposed to be those levels on the label 2 years later, 24 months later. It's supposed to still hit that level. So what we have to do when we're formulating is put in overages, understanding what's happening throughout the life of this product. We have to put in overages. And that can vary quite a bit. Like with B vitamins, it could be double the level. You
Oh,
know, with some of these, it's 5%, 10%, 20%. Some it's 100%. But that's what we need to do to deliver that full value and meet that label claim. And that absolutely does take a lot of work and testing.
exactly. And that's why people work with you, is to take them through that process when they're formulating a supplement, a new supplement, or even, repurposing supplements that are already out there, but putting their own brand on it. It still needs to go through the work, right, Shawn? Like if you don't do the work, it's not, it doesn't matter what it is, it's not what you're not taking what you're saying you're getting on the bottle sometimes.
100%. Yeah, exactly. And that's the frustration that's happening right now. And we're seeing with these companies that are cutting corners, to be honest, and getting on Amazon. You know, the
Right.
key to being on Amazon and crushing it on Amazon, like you're saying, is reviews and price. And
Right.
the price can be, if something's the cheapest, you got to wonder why.
Yeah.
Because I'm telling you right now, like when you're doing all the testing, when you're buying the best versions of ingredients, when you have a full quality control team, it costs money, a lot of money. And I know a number of these Amazon companies that have none of that. It's
Right.
one guy who's making stuff and just sending it to Amazon, and that's it. He doesn't care about the impact of it. He doesn't care about it, being efficacious. None of that stuff. And
No.
so it's very frustrating right now, like what's happening. And there's incentive to make it just as cheap as possible and throw up these fake reviews. And that's what you're left with right now.
Right, exactly. It's kind of a crazy state of affairs, but I think there's ways to manage it and ways around it. It's just by having good information from resources that you trust, right? And so, I have another question for you. So, there's, with all my patients, it's like this bell-shaped curve of patients, right? And bell-shaped meaning most people fall in the middle, where they feel like they want to take some foundational supplements and some extra things that they hear could be very beneficial, whether it be like acromantia, or maybe they're taking NR supplement or NAD supplement.
Mhm.
And those people are probably taking like 5 to 8 supplements a day. And then you have some people that don't want to take anything on one side of
Mhm.
the curve. It's like, I'm not taking anything unless I have
Yeah.
to. So measure my levels. And if I'm low, I'll take it. Otherwise, I'm not taking it. And those people, sometimes it's hard to convince of the health benefits of some of these things. And so we really try to limit them to what they need, and kind of step them into getting their head wrapped around the health benefits of certain supplements. But my question to you is, what about the people on the other side of the spectrum? The people that are looking up every longevity guy out there and taking 50 different things, all ordered from Amazon, making baggies of supplements, like the Brian Johnsons of the world that have
Yeah.
50 pills they take a day. Where do you see, like, where do you see that type of mentality being harmful?
Mm. I mean, this is very near and dear to my heart. You probably had this phase in your life too. I've been that guy.
Yeah.
I've been that guy. And what I found over time is that, I'm sure you have like when you're rounding as a physician, like I certainly had access to these guides as well as like you have drug nutrient interaction
Right.
guides. Like, I mean, there's so many things like look with like one drug we know what it does for the most part. It's been well studied, especially if it's been around a while. Sometimes, if it's two popular drugs that often get co administered, we kind of know what's happening. But with polypharmacy, and we would have people that have 7 to 10 pages of Mars, that where it's
Mhm.
literally 70 plus medications. You don't know how all that interacts. You don't know what's going on when they take the supplements, when their diet and with all these different medications, how they're interacting. And quite often, when it would be palliative care, they'd be taken off of everything, and then we'd see them have this incredible bounce back. And it's like, who's this person? Because all of these things are really interacting on a level we don't understand. And the same is true with the supplements. And that doesn't even take into account what we're saying about maybe there's, heavy metals in these things, banned substances in these things. Maybe there's suboptimal forms and you're getting, way too much of these suboptimal forms and it's actually making you more sick. maybe these things shouldn't be administered at the same time. So this is where, like, if one company is kind of has oversight to this, that has a medical doctor, that has a biochemist, a formulator, now you can say, like, look, this is how these things should be taken, by who, at what time, and you can feel safe knowing that at least that's been taken into account. But what I would say is that I believe that when you're taking way too many things, that the liver with its cytochrome P450 pathway is like kind of like starts shutting it down and saying there's too much stuff coming in. We're going to start reducing how much is coming in. And I've seen that, like, where, essentially the bioavailability or efficacy of some of these things can be greatly reduced. Add on top of that, I do believe that there's kind of a psychosomatic effect of, like, what kind of nervous system state you're in. If you're in like a hyper sympathetic nervous system state, that you're in fight or flight and you're not in like rest and digest and absorb and utilize and proliferate and best, use these nutrients, you're like, nope. So, there's that too. I think the person needs to be in more of a parasympathetic state, and a lot of that nervous system stuff needs to be addressed to best utilize these things. So I do think there's a lot of people that are taking way too many things. They don't know how they're interacting. They're listening to too many voices. Then there's just too much noise going on.
Yeah, well, that comment you just made about the state of your nervous system,
Yeah.
I never really thought about that, but it definitely resonates because
Mhm.
we know that your gut and your brain are so connected, and so is your immune system. So is, this entire um, chemical experience that happens inside of our body is controlled by a nervous system as well. And so taking your supplements what you're saying is taking your supplements when you're in fight or flight, they're not even probably getting a chance to work because
Exactly.
right. Yeah. That's so interesting. So interesting. There's a lot to this. I have a question for you about some things that are like we're hearing a lot about nowadays and just want to get your kind of take on these. What do you think about greens powders?
There's a lot to mention there. Like, I think
Right.
that the alkalizing thing is definitely overstated in terms of science. The idea of you being out of pH is very exaggerated. Your body, in terms of homeostasis, in terms of blood, especially, pH is so tightly regulated. You know about all the bicarbonate pathways and all this stuff that's going on. If you were, in alkalosis or acidosis, uh, respiratorily or in terms of blood pH, you can be dead very quickly.
Yeah, you need to
So
be in
I
the
think
hospital. Right.
yeah, yeah. So this is, I think, very overstated. But I think a reason that maybe there's been some interest around this alkaline diet, think like Tom Brady and some of these people that have had longevity and brought a lot of interest to it, is that they are eating a lot of greens and in particular things that have polyphenols. Now, the polyphenols, I do think is a family. If I was to put one, maybe that next category, if you were to ask me of what's really interesting,
Mhm.
as far as food and supplements, the polyphenols, if I look at the blue zones where people live to be super centenarians, they're slowing down, they have purpose, they have community, they're typically around water. All those things are great. And they usually have a high polyphenol diet. And so these are things like quercetin is in onions and apples, pterostilbene in blueberries, resveratrol in red wine, apigenin and parsley, fisetin, strawberries. These things are powerful compounds for anti-aging. They improve blood sugar, blood pressure. They improve NAD levels by inhibiting NADAs, the enzyme that breaks down NAD, also called CD38. And so, these are very powerful compounds that can be found in greens. And there's a lot of nutrients that are found in some of these greens that can be very energizing as well. So But another thing that I do have concerns about sometimes with these greens is you may be getting too high levels of anti-nutrients that are actually counterproductive to your joints, to your health, may impair mineral absorption. So you really need to have a strong understanding of what's being put into this. Like sometimes when we super concentrate things, there's a cost to that. You know, you're super concentrating the things that are good, but you may be super concentrating the things that aren't so good.
Right,
So you
right,
need to be careful and have a full understanding. This is where just, you know, a simple understanding of science can be more harmful than good. You know, that's where I know, like, I try and walk the line of being a credible scientist, clinician, and educator, you know, with like, because at some point when you simplify science down too much, it becomes untrue.
right,
And that's it's a hard line to walk, to like educate and simplify things, but still have it be true. And
right.
that's you know this very well as
Yeah.
well. It's a hard line to walk.
Right. No, you're absolutely right. And when you try to talk people through everything that we're talking about right now and actually show them the science about it, people's brains start turning off because it's just like too much information. But it is very complicated, especially with the polyphenol point that you made. The thing that I worry about with a lot of these green powders is there's very low levels of polyphenols, but very high levels of anti-nutrients sometimes. And so,
Yes.
right?
Exactly. And that's a whole cost thing, right? Like you can just make these proprietary blends that are again low cost, and they list a ton of things on the label. For those that don't know what a proprietary blend is, I mean, that's when you're, you know, listing 100 things, and according to the law, it just needs to be in order of descending mass. So the first thing on the list needs to be the highest amount of weight. Like let's say if something is 1,000 milligrams in the blend and there's 100 ingredients, that first ingredient could be 999 milligrams, and all the other 199 ingredients could be 1 milligram. And that's legal. And so they can list all this stuff, and you're like, wow, it's got all these things, but it really doesn't. It's called fairy dusting in the industry, like where you're literally like sprinkling in like a wish, you know, there's no real active there. And so that's very deceptive. And of course, this is a great way to save cost, but still have your marketing there. And so that's why I like full transparency labeling, where you're listing the genus, the species, the plant part, the standardization, the dose. So everything can be looked up. You know, you can go to PubMed, you can go to examine.com, you can go to whatever, Chat GPT or whatever your source is, and you can look it up and see what the studies actually are.
That's a great point there. Let's tackle one more in the little bit of time that we have left, if you don't mind. NAD, NR, NMN. Where do you stand with all of this?
That's a great question. Um, there's this whole like NAD salvage like pathway that you have to look at, that really, if a lot of other things that aren't in line, you may not be getting the benefit of any of these, to be honest. Like you really, like a lot of NAD depletion is related to diet, alcohol, junk light, not getting sleep, stress, you know, etc. So I think getting those things in line is really important. And then also, on the flip side of this is I want to look at inhibiting NADA's CD38 as much as possible. So that's those polyphenols. And we're seeing that you don't want to do that too much. You actually want kind of high doses a couple of days a month. Okay. And then these end up kind of being senolytic as well. Really interesting. As far as NMN, NR, right now, the government seems to be kind of attacking NMN. That's probably my favorite one between NMN and NR. NR seems to be pretty good as well, but I like NMN just being a little bit closer to the synthesis of NAD. But I'll tell you, like, actually, what's pretty compelling is the full flush niacin, nicotinic acid itself. There's a study where now this is super high dose, and you do need to be careful. You do need to think about this. There's implications to this. But in a study where they were giving 500 milligrams twice a day, so that's a full gram of full flesh niacin, and yes, you will look red and tingly and have the paresthesis and the whole thing. But they saw like an eightfold increase in NAD and muscle, and that is a dramatic increase. And so there's something to that as well. Like if you back up NMN, NR, a lot of these other compounds that are coming out around NAD biosynthesis, really at the core of it is nicotinic acid in particular. And I do like the full flesh niacin more than inositol hexanocotinate or niacinamide, these kind of no flesh niacins. That dose may be a little high, and if I would do something, I would probably do the full flesh niacin, maybe like 100 milligrams, and then an NMN or an NR with it, and then the polyphenol blend potentially at some points as well. And that would kind of be my ultimate stack there. And then I would support the mitochondria with PQQ, CoQ10, probably in the form of ubiquinol or MitoQ. Those would be great as well. And then ergothioneine is a nutrient I've worked on that enhances mitochondrial function as well.
Yeah, that's a great mitochondrial stack. You just kind of created for us right there. I love it. I want to rewatch this and take notes and put that together for myself. I love it. Last question. You talked a little about taking supplements at certain times and giving yourself a break from them, and just the concept around cycling supplements. And I'd love for you to talk to us a little bit about that as well.
I think this is important. Like think about even with medications, from just Western training that like there's a period right at the beginning when these medications are very effective, right? But over time, there is this homeostatic response where the body is trying to say like, what's happening here? Let's counterbalance this thing and try and change so that we can get back to the homeostasis, whatever that is. And you'll see, especially like with medications, one of the main ways that they'll work is by inhibiting an enzyme. And so the body over time will like start to find a way over and through and around, and it'll start working against this idea. And that's why you see like medications be very effective first week, 2 weeks, 3 weeks, 4 weeks. But over time, there's all these side effects that you hear in that commercial when it's like, it may cause head bleed. And all this stuff is because you're trying to block an enzyme. You're trying to put a dam in that river. And the body's saying, no, we're going to find a way around this dam because we're going to maintain homeostasis. So I think that same idea is important. And here's another example of like with exogenous testosterone, right? Like a TRT, testosterone replacement therapy. You'll stop making endogenous testosterone in the body testosterone because the body's seeing that there's plenty of testosterone, so we don't need to make it. So these are examples of like, I really feel that we should cycle these things to keep them effective, or else over time your body starts believing like this is the baseline. So it's just an idea. Like we don't have a lot of data around this, but I believe that things should be cycled. And it makes sense that like in our diets, we're not eating the same thing every single day, every single meal at the same time. That just doesn't happen. So I don't think our bodies were meant for that. We're resilient, and I think getting like orthomolecular doses at some point where it's super physiologic doses, and then getting none of it, and then getting whatever, like this is where this idea of personalized medicine is really going to take us to the next step, where we can actually do this, where we can actually start working on this with patients, is varying the levels of these different nutrients so that they get the most benefit. And we see this with diet too, by the way, where you can be dual fuel if you have, if you're ketogenic at some points and then you carb up at others with like cyclical ketogenic dieting or targeted ketogenic dieting. We've seen protein cycling where when protein's too high, your body will start to oxidize all that protein and you're not utilizing it. But if you go through a period of fasting and then you have high protein, boom, you get the benefit. So,
Right.
this is where cycling, I think, is important. And wherever I look in science, there seems to be support for it, even though I don't have a lot of support for it around supplements in particular right now.
Right. No, absolutely not. And it's just intuitively knowing the science, like you're saying. Like
Mhm.
I saw a graph right before this. I was doing another conversation with Dr. Perlmutter, and he has this beautiful slide where he shows Homo sapiens evolved for 66,000 generations, going through seasons, going through periods of starvation, and then having a lot of food. That's one of the reasons why we like the taste of sugar, because that's nature's signal to take as much of this sugar in as you can to make fat, because winter's coming and you're not going to have enough energy around to consume. And all of this is so genetically ingrained in 66,000 generations of human evolution. And we've only spent 12 generations being in this industrialized kind of paradigm that we live in now, where everything's available all the time. And look what's happened. We've gotten sicker, right?
Yes, yes. So that has to do with like we're bringing in weakness because we're so
Right.
controlled. Like there's the examples of being like thermically controlled, like where we're at room temperature all day, every day at our work, like in our car, in our house. And it's creating weakness where we're not used to being exposed to extreme heat or extreme cold. We're not used to going without food and then feasting. We're not used to like all these different stressors and exposures that we had in the past, and it's creating weakness. Our sirtuin genes get turned on by having difficulty, by having stress to the body. And this is like the idea, like stoically, where the obstacle is the way, right? Like that we have that difficulty that creates greater strength, that it turns on these sirtuin genes, these SIRT genes, where we have greater longevity. Like when everything's controlled for us, we become that boy in the bubble where just that one little bacteria can kill us. Like that's the worst thing we can do is be, sanitizing everything and fearful and having our junk light and being in our processed air and eating the same thing every day and so controlled. Now we're weak. And this is what you're seeing in society is that we're very weak despite having access to all the things that we have. We need to bring back in hormetic stress and create greater allostatic capacity.
No, very well said. Well, Shawn, this was a great conversation. I mean, you are truly not just are you a scientist, but you can speak to the general public and really bring these complex topics to everyday reality and to everyday use. And I just loved talking to you, Shawn. This was a great conversation. Can't wait to do it again sometime.
Oh, thank you, Darshan.
Awesome. Well, we'll stop there. You know what, Shawn? I would love to get you. You've done some speaking for YPO too, right?
Yeah,
Yeah, I'd love to get you. I'm in charge of the Health and Wellness Network for YPO now. I'd love to get you in front of that whole audience. Did I make an introduction with you to?
that would be wonderful.
Yeah,
Yes.
let's do that because it's huge. I mean, it's a huge audience, and these are all the people that that you want to do business with too. So I'll make that happen for sure.
Perfect. Thank you, Darshan. Yeah, I appreciate it. This is a great conversation, and we'll get you this recording and we'll go from there.
Please, yeah, get me the recording as soon as possible, and we'll start putting it out there. Thank you.
Okay. All right. See you, brother.
Take care, buddy. Talk to you later.
All right. Bye.